Nice warm towel going on. And clipping and revealing the back of a leg. Okay, so just bringing that knee bent with the lower leg up so I can massage that lovely calf muscle. Nice strong calf muscle. So I'm encouraging the correct movement for the blood circulation, the muscle and also the lymph. Making sure the Achilles is soft. And the heel of my hand, that thenar muscle, is pressing deep into the calf here. There is a lovely split in the calf muscle. The main muscle there has 2 heads and 1 foot. So there tends to be toxins sitting very happily there, which I like to remove, otherwise it produces things like cramp in the calf. Again, using my double thumbs there. And now a 3-finger overlapping upward technique to work on the central posterior part of the leg, always upwards, right up to the bone, just at the base of the pelvis and up to the side of the pelvis. I always think with massages they tend to stop at the top of the leg and they need to wrap around up the side of the pelvis so that our whole body feels as one, not lots of individual parts. Fantastic. Working into the foot. With 2 fingers, I'm just going to place my knee under there. This can be sore, painful for some, but I can sort of normally tell when it's a painful foot. There are areas that need more attention than others. Circling the foot. Lovely. Massaging into that Achilles again and covering the foot over. Revealing the other leg. Perfect. Introducing the oil to the foot, which is a little dry, up into the calf, back of the knee, and up into the thigh, the side of the hip. Just securing the hand, working the side of the hip and the thigh there. And now going to bend the knee. That's it, lovely. With a nice upward action of that lower leg so that I can get into the back of the calf, using my heel of my hand downwards. That feels really good. I can tell by the action, the movement within the foot and the ankle when I'm coming down here that it's having the desired effect. Working on that Achilles. And up into the calf. And 3 fingers overlapping again, upward movement up the posterior of the leg. Right up to that lovely hard bone at the back of the pelvis, giving it a little activation. And now firm hands up the side of the leg. Massaging into the foot, the soft tissue around the instep, the ball of the big toe, and then this area which is the lungs in reflexology, around the neck, which is the neck of the big toe, but it's also in reflex terms the neck of the body. Around the sides, the back and the other side, and then into the heel, so into the lower back. This is the sacrum, and around the other side, which is the knee, the hip, and the elbow, coming up to the shoulder point and stretching through every toe where we can clear our sinuses. Into the sides of the heel, which relates to the ovary and one side of the uterus. Nice good massage to clear. Okay, so I'm going to take your bobble out, Katie, because I don't want you lying on it. Feel okay? Yep. Revealing the front of the leg. This oil is going down very well. Soaking in beautifully. Beautiful organic sunflower oil with calendula, frankincense, patchouli, sweet marjoram. Wonderful. So stretching out the leg first of all. Nice stretch. Using quite firm upward pressure, lightly down, firm over the shin, over the quadriceps, stimulating warmth, circulation, lymph movement, and slowing down. It's nice over the knee, each side of the shin, and then over the knee, around, circling the knee and the bone, the patella, moving into the muscles, tendons, the bursa, feeling into that creakiness of the knee that can be there. It's not too bad actually. Now just encouraging the knee to shift left and right and up and down. That's really good. It's a nice movement there. And then drawing toxins away, down and behind the knee, and then stimulating behind and stimulate. And working across at an angle where the Sartorius muscle is, bringing it over to relieve, lengthen, relax. And upwards on the sides of the thigh. Once those toxins have been brought over with that cross angle, now taking them right up to the pelvic region where we have lymph nodes in the pelvis called the inguinal lymph nodes, which is more like a lymph factory. It's a nice big site which eats away toxins. It's fantastic. And now just massaging that side of the bone, the lower iliac. Leg. Oil into the foot, the toes, the whole front of the leg, picking it up, lengthening, stretching, reminding the pelvis to let go. Nice and warming upwards. Stretching downwards. Up the shin. And into the knee. Circling around the bone. Moving the bone if it will. Yes, that's good. A little bit of a creak. And then up and down. Stimulating the lymph node behind by moving the fluids away from the knee first, and a little stimulation behind. And then up with that crossover maneuver, bringing the muscle in this outward direction to lengthen and restore the correct alignment of muscle to bone. And then upwards, back up to that hip point in the pelvis, the sides of the pelvic girdle. A nice lengthening again before I work on the ankle. Turning into that ankle once more, and then around the ankle. Up the front with 2 thumbs, over the top of the bony part of the foot. Beautiful petrissage. And then into that lower back part of the side of the heel, up and stretch the spine out. Circling into that toe joint, the big toe being the neck of the body. And circling a little tug on each toe. That's really good. Back to the fleshy part of the foot underneath, encouraging the lungs to breathe, the eyes, the ear, for all of it to feel clear, stimulated, and at one. Coming back to this ankle, giving it a little turn over the top, around the sides, up. Wonderful. And then into those metatarsals. Again, a nice circular rotation of the toe. Little clicking here on the little toe.